Hi there, this is Christopher Mitchell, and this is the Module 6 assignment for Foundations of Nursing Practice, where I will be presenting an SBAR report to a physician. In this presentation, I will be presenting the SBAR report to Dr. Reese, who will be playing Dr. Reese over here. I will be presenting scenario number 6 in the NICU. And the scenario is baby Z is a 3-week-old infant in the neonatal intensive care unit, nursery 2. He was at 27 weeks gestation when he was delivered. He has been progressing well after a short period of CPAP therapy and remains at 24% flow support. He is receiving continuous tube feedings. He has demonstrated a steady weight increase. For the first time today, he has had a couple of episodes of apnea. When Sue, the evening nurse, came on and did her assessment, she noted he was tachypneic with a respiratory rate of 75. As she was documenting her assessment, baby Z had a bradycardia episode and his oxygen saturation decreased to 75. His heart rate returned to 130 with stimulation, and Sue then increased the oxygen flow to 28% from 24%. He also had some regurgitation of formula. His muscle tone is very diminished and his coloring is mottled. She listened to his breath sounds and noted that they were equal and clear. His abdomen is soft and not distended. The day nurse reported that he had slept a lot today, and his mother felt as if he wasn't as alert as usual. So I will be starting with presenting my SBAR report to Dr. Reese over here. Dr. Reese, my name is Christopher Mitchell, and I am a nurse in the neonatal intensive care unit on nursery 2. I am calling about baby Z, a 3-week-old infant in the neonatal intensive care unit in nursery 2. I am communicating with you because I am concerned that baby Z has had a couple episodes of apnea, and the evening nurse documented that baby Z was tachypneic with a respiratory rate of 75. During documentation of the evening nurse's assessment, baby Z had a bradycardia episode and his oxygen concentration decreased to 75%. His heart rate returned to 130 with stimulation, and the nurse increased his oxygen to 28%. Some regurgitation of formula was observed along with loss of muscle tone and mottled coloring. Breaths were equal and clear, and his abdomen is soft and distended. Report from the day nurse indicated that the baby slept a lot today and that the mother felt that he was not as alert as he usually is. Background on the situation: the baby was admitted because of very low birth weight. Child was delivered at 27 weeks gestation with no weight given in our report. The baby Z was previously on CPAP therapy and was getting 24% oxygen support. Oxygen flow was increased to 28%. Information regarding the past 3 weeks should be included in the medical record, which we will need to find, and I will provide for you. It's been reported that the child has been sleeping a lot, and the mother states that the child is not alert as he usually is. Baby Z is receiving continuous tube feeding. His ventilation O2 was at 24% flow support. Intubated. CPAP therapy, and a short period nasal cannula was not given. My assessment is we need to get an updated reading on vital signs, which include, the most recent include the respiratory rate of 75, which was then returned to 130. I'm sorry, his respiratory rate was at 75. His heart rate was at 130. So the respiratory rate was definitely higher than normal. The baby's temperature was not given. The baby's blood glucose was not given. The baby's blood pressure was not provided. His oxygen saturation was at 75%, which is definitely low, which caused us to increase the oxygen flow rate to 28 from 24. The baby is showing signs of premature apnea, and we have observed loss of muscle tone and mottled coloring in the skin. The baby is also observed to be tachypneic. Recommendations that I have come up with include that I've already increased our oxygen level to 28%. Heart rate decreased to 75, which returned back to 130 with stimulation, which is a little bit more normal. I'd like to ask you to please give orders to carry out in order to improve the condition of the child. For instance, possibly stop the feeding to correct the regurgitation of formula. We can increase CPAP therapy to try to find more improvement with the apnea, sleep apnea. We can address the bradycardia episode and the oxygen concentration dropping to 75, possibly by increasing continuous oxygen order. We should also address the loss of muscle tone and the mottled coloring of skin, which can be because of the low oxygen concentration. We need to address the excessive rapid breathing. I believe that the child is experiencing premature sleep apnea. I'd like to ask you a few questions on how often should I continue observation. When should I call you back if there's no improvement in the child? And if I need to, may I repeat the plan back to you? If not, I'll continue. All right.
Yep.
I will be asking a series of questions, including what are your thoughts on the clinical scenario? What do you think could have been added to the SBAR? What do you think we did not need in the SBAR? And if we had this conversation again, what should we do differently? Starting with the first question of what were your thoughts on the clinical scenario? My thoughts on the scenario are that the baby is in need of clinical intervention to improve his condition. Dr. Reese must generate a definitive diagnosis based on the information that we have provided in order to improve the condition of the baby. With nursing intervention of increasing oxygen flow, the baby seems to be sleeping more soundly without any signs of apnea, although the mother is concerned about the baby's alertness. Overall, my thoughts on the scenario are that we were very thorough and that we provided the physician with as much information that we had on hand, and that we would continue monitoring to provide any additional information that would help come up with a good diagnosis for the doctor. What do you think could have been added to the SBAR? More vital signs could have been added to the SBAR and obtained, including blood pressure, possibly a blood sugar reading, updated pulse rate, continuous reading of a pulse rate, current temperature, a more definitive tube feed flow rate to see if we can make any adjustments with that to reduce the regurgitation. Also, continuous updated oxygen saturation readings, especially after we increase the oxygen flow to see if this improves the numbers at all, as well as an extensive report of the past 3 weeks of medical history of this particular patient in order to provide the physician with a more comprehensive and holistic history. What do you think we did not need in the SBAR? I think that we could have left out information about the abdomen being soft and distended. That doesn't have much to do with our situation. All of the other information that we provided is very important to share with you and the physician in this situation. If we had this conversation again, what should we do differently? If this conversation were to be conducted again, we would have included more thorough report of medical history, like I said, over the past 3 weeks, some more updated vital sign report, including updated numbers of oxygen concentration in response to the increase in the oxygen flow rate, as well as an updated pulse rate to check for bradycardia persistence. Bradycardia episode, an oxygen concentration of 75 must be addressed. We need to address this immediately, and that's something that we need to make a priority to communicate. And we need to continuously monitor our oxygen concentrations with an increase in oxygen flow rate, and we also need to address the loss of muscle tone and mottled coloring, which can be indicative of the low oxygen concentration. Thank you, Doctor.
Thank you.
Once again, this is Christopher Mitchell for the Module 6 assignment for Foundations of Nursing Practice for Module 6 in the SBAR report. Thank you very much.